Okay, so we're gonna show a method or technique we came up with for doing a pediatric tracheostomy in an emergent situation very quickly. Of course, you can do a regular tracheostomy like would be done in the operating room, but that's, in our experience, much too slow. You want a procedure you can do in less than a minute or quicker. So we came up with this idea of in a formal trach in the operating room, they put 2 stay sutures in each side of the trachea, and before that, they clean off the trachea so that they can see it very well. They can get the stay sutures just in the right place. We don't have time to do any of that, so what we're gonna do is just make a skin incision, go down to the trachea. The trachea will be surrounded by muscles and other tissue that's kind of in the same muscle plane. And then without cleaning it off completely, we're just gonna take a single suture and go sagittally or longitudinally down the trachea, try to grab at least 2 or 3 or more rings. So we have a really good grasp of the trachea. And then we're gonna make an incision into the trachea above where the suture is. So if the child is really small and we cut the trachea in half, which is a risk, then we have control of it still, and we can get something into it. And what we're gonna put into it is the neonatal bougie, which is very small, and then we're gonna put a 3/0 tube over the top of that. This drain is probably the size of a newborn trachea or maybe a 6-month-old trachea. So it's about as small as you're gonna hopefully come across. And so we train on something like this, thinking if we can do it on this, we can do it on a bigger trachea too. So we're gonna go ahead and do the procedure. All you need to do the procedure is a scalpel, some sort of a small scalpel. Doesn't really matter which. A silk suture, O-silk, and I bent the needle at 180 degrees just so I can make a smaller radius with my grasp, and then the neonatal bougie and a normal endotracheal tube. Okay, now I'm gonna go ahead and do the procedure in real time. The one instrument that I didn't mention that you need is some small clamp, either straight or curved, for blunt dissection, because after you make your skin incision, you're gonna wanna quickly dissect, usually in the sagittal plane, through the soft tissue, down next to the trachea on both sides. And you're not gonna totally clean the trachea off, you're just gonna go down around it so that you can feel where the trachea clearly is, even though it's gonna be still surrounded by some muscles and other soft tissue. Okay, so I'm gonna make at the level just below the cricoid ring, the head's up here, the feet here, just below the cricoid ring. We don't wanna go in the cricothyroid membrane because it's too small in these children. So at either the 1st, 2nd, 3rd, or 4th, in that area, tracheal ring, I'm gonna make a 2 or 3 centimeter incision right over the top of that of the skin, all the way down to the trachea, but not through the trachea. And then I'm gonna quickly dissect. I'm gonna put this clamp in this direction and quickly dissect. You can pretty aggressive, you're not gonna hurt anything in the midline here with a blunt instrument. Down around both sides of the trachea. And then I'm gonna grab with my fingers, I can feel kind of where the trachea is, but I can't see it. And I'm not gonna waste time trying to see it. And I'm gonna put my silk suture sagittally and grab at least 2 or 3 rings here. And then I have my stay suture in. Okay, so an assistant can pull up on that a little bit so I can really feel where I am. And then on the upper side of where the stay suture is, I'm gonna make a small incision. And you can make a cross if you really want to, but I wouldn't. Just do it quickly. And then I'm gonna put my bougie, neonatal bougie, into the trachea, and then I'm gonna have an assistant, or I can load the tube over it. And this is a 3/0 tube, and then you're just gonna push it into the hole, 1 centimeter deep maybe, and I'm done. And you can see how that's quick. I didn't take the time to clean off the trachea, but I did get a stay suture in it in case I cut the trachea in half, or in case I'm working in a hole, which I would be. I can have the assistant kind of pull the trachea up out of that hole. Small children have really flexible tracheas, so you're going to be able to pull up pretty good on that without tearing through it. We did try to do this procedure with the stay suture going across the trachea in this direction, and it sometimes tore through. So this will not tear through if you got a couple rings.